Welcome to Hot Wired. In today's top story, measles cases reach 33-year high nationwide as NYC urges vaccination. New York City, a global hub, is facing a familiar public health challenge: measles. While the city has avoided a major outbreak so far in 2025, a concerning national trend underscores the ongoing need for vigilance and vaccination. This year, the U.S. has seen its highest number of measles cases in 3 decades, prompting urgent calls for action. Let's delve into the situation in New York in the broader national context. 7 confirmed measles cases have been reported in New York City's 5 boroughs this year, the most recent in early July. This number is comparable to 2024's total of 14 cases statewide, with 14 in the city itself. While the City Health Department assures these are sporadic cases linked to NYC's international connections, they emphasize that outbreaks can easily occur in areas with low vaccination rates. This highlights the critical importance of timely MMR vaccinations, starting at 12 months of age. Statewide, New York has recorded 14 measles cases in 2025, a figure that mirrors last year's count. State health officials are urging New Yorkers to verify their vaccination status, particularly before traveling internationally to areas experiencing outbreaks. This proactive approach is vital in preventing the spread of this highly contagious disease. The urgency is underscored by Senator Chuck Schumer's recent letter to the Secretary of Health and Human Services, Robert F. Kennedy, Jr. Senator Schumer's letter sharply criticizes the Secretary for allegedly undermining vaccine efforts, cutting public health funding, and dismantling crucial federal safety measures. He accuses Kennedy of politicizing the recent overhaul of the CDC Advisory Committee on Immunization Practices. Schumer calls for a national public health emergency declaration regarding measles. In response, the Department of Health and Human Services states it's providing aid to outbreak zones and notes that the U.S. measles rate, while elevated, remains lower than in some European nations. However, they also reiterate that vaccination decisions are personal, advocating consultation with healthcare providers. Nationally, the picture is more alarming. The CDC reports over 1,288 confirmed measles cases in 2025, exceeding the 2019 numbers, which were largely driven by a New York City outbreak. The majority of current cases are concentrated in areas that have experienced outbreaks, including parts of Texas, New Mexico, and Kansas. This underscores the contagious nature of measles and the importance of herd immunity. In New York City, while the overall MMR vaccination rate for children aged 24 to 35 months is around 95%, a new city data dashboard reveals significant disparities. Some zip codes show vaccination rates below 70% for 2-year-olds, creating pockets of vulnerability. Governor Hochul and state health officials are voicing concerns about children not receiving their MMR shots on time, leaving them inadequately protected. This highlights the need for targeted vaccination campaigns in underserved communities to ensure equitable protection against measles. The fight against measles requires a multi-pronged approach: timely vaccinations, robust public health infrastructure, and clear, consistent messaging. The situation in New York City, while currently manageable, serves as a stark reminder of the potential for resurgence and the importance of maintaining high vaccination rates across all communities to safeguard public health.